Encyclopedia of Health for Travellers. Welcome to Thailand, the land of smiles, and to its wealth of hospitality, ancient monuments, excellent food, and gorgeous natural scenery. As expert travellers, you will, of course, want to make your stay here as comfortable and pleasant as possible. Good times depend on good health, which you can enjoy throughout your journey here if you learn a few basic facts and actively avoid the dangers and diseases sometimes found in this part of the world. The following explanation is intended as a guide to what you should never have to encounter during your weeks of discovering the gem of the Orient called Thailand. Dengue fever is caused by a virus transmitted by a species of striped mosquito and is prevalent everywhere in Southeast Asia, in both urban and rural areas, especially during the rainy season. Mosquitoes of this type fly out in search of food during the daytime. Victims of dengue fever will suffer from major fever symptoms, such as a high temperature, a headache concentrated around the eye sockets, aching all over the body, especially the joints, fatigue, and light red patches on the skin. The most effective way to avoid this illness is to apply insect repellent and sleep either under a mosquito net or in rooms with screened windows, thereby preventing mosquito bites. Chikungunya is the name of the ailment caused by the toka virus and is spread also by mosquitoes. Its symptoms are similar to those of dengue fever, namely feverishness, aching of the head, stomach and entire body, and light red patches on the skin. Chikungunya can also affect the respiratory system. The severity of muscle pains and stiffness of the joints is greater than with dengue fever, and more time is needed to recover from it. The method of preventing it, however, is the same, namely to avoid mosquito bites during daylight hours. Diarrhea is the most common affliction for travellers and can be caused by a virus, bacteria, protozoa, worms, chemicals or toxins containing food or drinks. It can happen at any time of the year, but is more likely during the heat of summer when high temperatures tend to promote the growth of organisms. When an unwanted foreign substance begins to disturb the body's digestive system, the body attempts to expel the intruder as thoroughly and rapidly as possible, hence the constant spasms associated with diarrhea. The sufferer will be forced to excrete watery stool or even liquids. But if this condition is not remedied soon enough, the body will undergo a severe loss of fluids and minerals, a state that could result in shock or even death. Diarrhea is usually caused by consumption of contaminated or insufficiently cooked food or beverages. The easiest way of avoiding it, therefore, to choose clean, well-cooked food for every meal, to wash your hands and make sure your eating utensils are scrubbed clean as well, and to stay away from raw or partially cooked foods, especially seafood. Oysters that have not been thoroughly cooked are particularly potent sources of severe diarrhea. Hepatitis or inflammation of the liver is caused by a virus transmitted through the exchange of bodily fluids. Sexual behaviour, such as a careless choice of sexual partners, both heterosexual and homosexual. Behaviours associated with drug addiction, such as the sharing of needles. Tattooing and blood transfusions are all means of contacting hepatitis. Symptoms of hepatitis include loss of appetite, nausea, vomiting and jaundice due to the abnormal functioning of the liver. Hepatitis has also been associated with a high risk of liver cancer. Hepatitis can be prevented by vaccination, particularly when applied to groups engaged in the high-risk behaviour mentioned earlier. Japanese encephalitis is prevalent in rural areas of South and Southeast Asia. It is transmitted by mosquitoes infected by their contacts with certain animals, particularly swine or pigs. Victims of this disease will develop sudden high temperatures, headaches, fatigue and muscle pain, followed by seizures, spasms and possible even mental and nervous paralysis. If you are planning to travel in rural areas for an extended period, the best means to prevent Japanese encephalitis is by vaccination, which consists of a course of 1 injection per week over a course of 3 weeks. Malaria is a disease endemic to tropical regions such as Southeast Asia and is transmitted by mosquitoes. A report by the National Center for Communicable Diseases in Atlanta, Georgia, USA, indicates that malaria is not a major concern for foreigners travelling in Thailand, with an average of only 5 cases per year resulting from having incurred malaria in Thailand. Symptoms of malaria begin with a fever, cold shivers, perspiration and headaches. These symptoms may subside and recur several times or immediately develop to a critical point. The likelihood of contracting malaria is strongest along forested border areas or uplands. The strains of malaria now in existence are almost entirely resistant to treatment by drugs. The most effective way of preventing it, therefore, is to apply insect repellent and sleep either under a mosquito net or in rooms with screened windows. Meningococcal meningitis is rarely found in Thailand, but has been reported more frequently in the poorer areas of Nepal and northern India, as well as in the refugee camps along the Thai-Khmer border. Those infected with this disease will immediately develop a fever, followed by severe headaches, vomiting, stiffness of the neck, blood-coloured blotches on the skin and unconscious spells. A and C group vaccines taken before travelling are among the safest and most effective means of preventing this illness. And can be obtained in Europe, Australia and America. In Thailand, these vaccines are available at the Sowapar Institute, among international organisations working to control the spread of communicable diseases among refugees and from major hospitals throughout Thailand. Rabies is commonly believed to be contracted only from dogs, but is in fact communicable from all types of warm-blooded animals, particularly mammals and forest creatures. In Thailand, dogs are the main source of rabies, followed by cats. A creature infected with rabies will expel the infection through its saliva. You, in turn, can be infected by its biting or scratching you, or the entry of the saliva into your body by means of an open sore or wound. When infected by rabies, a person will suffer inflammation of the brain and spinal tissue. The infection will take place in 3 stages. In the first stage, the victim will experience headaches, loss of appetite, vomiting, emotional instability, and irritability. In the second stage, the infected person will be subject to nervous disorders, madness, hydrophobia, fits of howling, and hallucinations. Finally, the muscles of the eye and larynx will become paralyzed. Breathing will accelerate spastically, and death due to heart failure will occur within 7 days. There is presently no known cure for rabies, one of the deadliest diseases known to man. You are advised, therefore, to be very cautious in the vicinity of stray dogs or pets whose vaccination record is unknown. If you are bitten, seek immediate advice from a doctor. In Asia, most sexually transmitted diseases encountered by travellers take the form of inflammation of the urinary tract, and gonorrhea symptoms will depend on the type of infection, and their treatment can be affected by antibiotics selected for that particular ailment. It is also recommended that you consult a physician who will conduct an examination, determine the cause of infection, and prescribe the appropriate treatment. Prevention is best practiced by avoiding those groups most at risk of disease, such as sexual service personnel and homosexuals. Otherwise, for your own safety and to reduce the chance of contracting a sexually transmitted disease, use a condom when in sexual contact with anyone among these high-risk groups. Trichinosis is incurred by consuming raw pork, such as may be found in fermented pork sausages, which contain roundworm larvae. When ingested, these worm larvae manage to occupy the cells lining the wall of the small intestine, reproduce to become thousands of larvae, insinuate themselves into the lymph glands and blood vessels, and then spread out to infest the entire body. They are particularly evident in the muscles of the diaphragm, the calves of the legs, the arms, and the ribs. The symptoms of trichinosis depend on to what extent the infestation of larvae has occurred. If extensive, after 2 to 3 days, the victim will experience stomach aches, diarrhea, vomiting, and nausea, followed by a high temperature, pain in the muscles, and blood issuing from the conjunctiva and eyeballs, and from under the fingernails and toenails. When the larvae have infested the muscles, many of these symptoms will disappear, but muscle pains and fatigue will continue indefinitely. Prevention of trichinosis consists in refraining from all raw foods, particularly at places that serve food illegally. Typhus is frequently found in rural areas of Thailand and Malaysia that lack proper hygiene or are overcrowded and is transmitted by body lice or their droppings. Lice that have fed on the blood of an infected person suffering from a fever may then bite another person who infects himself or herself by scratching the bite. Lice droppings can also be a medium if someone inhales them. The symptoms of infection are a sudden illness accompanied by headaches and fatigue. Subsequently, the victim will have spots over the upper part of the body, which will then spread to cover the entire body except the face, palms of the hands, and soles of the feet. After about 2 weeks, the patient's condition will suddenly improve, possibly to be followed by a weaker recurrence of the same symptoms. To avoid contracting typhus, you should sleep in clean, hygienic areas. Take frequent baths or showers and wash your clothes regularly. For those most at risk of infection, another good means of prevention is to treat your clothes with an insecticide whose effects are long-lasting. We hope that you will enjoy your travels in Thailand and take with them an awareness of how to prevent illness and disease. Our sincere concern for you includes everything that can make your stay with us a truly satisfying experience, as expressed in the smiles and hospitality of this land of Siam.